Dr. Sreedhar Potarazu joins me now. He's CEO of Vital Springs Technologies, author of Get Off the Dime, The Secret of Changing Who Pays for Your Health Care. Dr. P, always good to have you here. Thank you.
Thank you.
So just to back up a bit, the suggestion is, in terms of insurance coverage and Medicare coverage, as I understand it, if you're in the hospital and then you're released and then you're readmitted within a 30-day period, what they're suggesting is, well, you must have done something wrong. Maybe you didn't keep that person long enough, and so because of that, the hospital will get a smaller payment from Medicare, drop it by 1%. If you have to treat that person again within the 30 days, you must have done something wrong as a hospital. That's the suggestion. Am I right?
That's exactly right. And this was meant to be the mechanism by how the Obama administration was going to try to pay for the Affordable Care Act, was by reducing reimbursements to hospitals and penalizing them if they weren't delivering quality care. But what happened, when the Supreme Court ruled that the mandate could hold, is that hospitals were hoping that they would make up for these decrease in payments with the states expanding their Medicaid rosters so that they could get more patients and make up for these decreased payments. But now that the states may or may not have to conform, the hospitals that have been on life support are ready to have the plug pulled because they're really concerned about taking this cut on the readmissions and not having more patients maybe from Medicaid sign up to make up for those losses.
Yeah. Let me ask you about this underlying premise. I mean, there is a feeling in this country, and I have felt it in my own, experiences with family and friends, as other people have, that some people get kicked out too soon. And then, you know what? The hospital is making a mistake, and they should have kept that person another 24, 48 hours, and then they might have prevented what ended up making them come right back into the hospital. I mean, is that an issue, do you think, in hospitals today?
It's a great point, because the good hospitals may end up getting punished and the bad hospitals may end up getting rewarded. And here's the fallacy, that unfortunately, if a patient dies in the hospital during their admission, that never gets considered as a readmission rate. But the good hospitals, and let's say a teaching hospital or a university hospital that is taking care of sicker patients, is actually getting penalized for that, for actually being a good center. So the mechanisms of how these incentives have been put in place have been done in a vacuum that really is counterintuitive to what's in the best interest of the consumer, the patient getting the best care.
So what happens if someone has, a heart incident and they go into the hospital and they're checked in for 24 hours and then 10 days later the chest pains come back and they go back into the hospital? Do you fear that, would they be the hospital's not going to turn them away just because they come back within 30 days, are they? And what plays out?
The hospital won't turn them away, but that's a great example because that's the one we often give. So that if you have heart failure and you've been discharged, there's a number of things that have to happen when you leave the hospital, right? You've got to make your appointment, you've got to get your medications, you've got to make sure that you're conforming with your diet. They're holding the hospital accountable for everything that happens after you leave the hospital. But the reality is that there's so many other people in the community, including the patient themselves, that are responsible. And so you've got to coordinate the care for all of that in order to minimize the incidence of that person rebounding. And none of that is in place today. They've just isolated the hospital and said, look, you're going to be responsible no matter what happens in terms of whether the doctor wasn't accessible or you got the wrong prescription or didn't get the prescription filled. And it really could end up leading to longer wait times because people are going to be fearful about taking care of patients and getting penalized. The hospitals will have to absorb it, but it's going to mean that they're going to take bigger losses now and not get the patients, as I said earlier, to really sustain themselves.
Yeah, it's like another example of a situation where the actual healthcare decision is being taken further and further away from the people who are intimately involved in it. Doctor, thank you very much. Dr. Potarazu.
Thank you.
Good to talk to you.
Thank you.